In the huge world of global healthcare, there's this expert kind of working in the shadows who you've probably never even thought about. But their work, it's absolutely critical. So today, we're going to pull back the curtain on the incredible field of medical translation.
Just let that sink in for a second. What if one single word was the difference between getting better and getting seriously hurt? In medicine, precision isn't just important, it's everything. One tiny mistake, one misunderstood word, can completely change a diagnosis, mess up a treatment plan, or, lead to a really serious outcome. We're talking life and death here.
And look, this is not a hypothetical. This happens. Giving a patient the wrong info about their medication can have absolutely devastating consequences. This is where the stakes are as high as they get. And this is exactly where our invisible expert comes in.
All right, so what exactly is this field we're talking about? Well, think of medical translation as this vital, invisible bridge. It's what connects patients, doctors, and researchers who all speak different languages. It's all about making sure everyone is crystal clear when it matters the most.
Okay, so here's the formal definition, but trust me, it's so much more than just swapping words. It's about taking really complex medical research, the findings, the methods, all of it, and converting it into a language that a much wider audience can actually get. We're talking everyone from policymakers to doctors, and maybe most important of all, the patients themselves.
And the sheer scope of what these translators work on is, it's huge. One day they could be deep in a super dense academic research paper, and the very next, they're working on a simple, easy-to-read brochure for a patient. The real magic, the real skill, is being able to switch up their language and tone to perfectly fit whoever's reading it.
Okay, so what does it really take to do this job? It is so much more than just words.
Yeah, this quote from the International Medical Interpreters Association pretty much says it all. You have to have an almost native, super formal level of the language. That's just the starting point. What really sets these professionals apart are their analytical skills and a deep cultural knowledge. Think about it. Different cultures might describe pain in totally different ways. A good translator needs to catch those subtleties to make sure the doctor understands exactly what's going on.
And you can see their contribution across the entire healthcare system. When it comes to patient care, they're the ones making sure treatment instructions are actually understood, which prevents really dangerous mistakes with medication. In something like clinical trials, they're translating consent forms so people know exactly what they're signing up for. They're like this invisible thread, weaving through and connecting every single part of modern medicine.
All right, let's dive into what might be the biggest challenge of all. It's like decoding a secret language. Because these translators don't just have to be fluent in, say, English and Arabic. They have to be fluent in the unique, specialized language of medicine itself.
And this fluency is really layered. It starts with the fundamentals, the absolute basics of anatomy. You have to know the exact term for every single part of the body. There's just no room for error.
From there, we move up a level to diseases and disorders. This is where you need absolute pinpoint precision for conditions like diabetes. Even a tiny little change in meaning could make a doctor completely misunderstand a patient's condition.
And then there's pharmacology, medications. Here, the stakes are immediate. A mistake translating the name of a painkiller or its dosage, that could have direct, dangerous consequences for a person. It's like a constant high-wire act where precision is everything.
But here's the thing. The real complexity isn't always in those super long, complicated medical terms. Sometimes it's hidden in plain sight, in something that looks like a simple abbreviation. Just look at DNA. To you and me, it's just 3 letters, right? But a professional medical translator knows that's an acronym for a massive scientific concept. They can't just translate DNA. They have to know it stands for deoxyribonucleic acid and translate the entire term. That's the incredible level of expertise we're talking about.
So, okay, after all that, why does this matter to you? It's because this isn't just a technical skill. It's about human impact.
And the way this technical skill turns into human impact is actually pretty simple, but so powerful. It's a chain reaction. Step 1, accurate information gets translated. Step 2, that allows patients and doctors to actually communicate effectively. And step 3, the result is that patient safety goes way up and the quality of care for everyone improves. It's that direct.
So let's just quickly recap the big takeaways here. Medical translation isn't some tiny niche service. It's fundamental. It enhances patient safety. It improves the quality of care. It's what lets researchers from all over the world work together on the next big discovery.
And maybe most importantly, it breaks down barriers that stop people from getting the healthcare they need. It's a true cornerstone of modern medicine.
So the next time you see a patient leaflet or a consent form that's been translated, just take a second and think about that invisible expert, the one who made sure every single word was a bridge to better health and not a barrier.